And joining us now is Dr. Ian Gonsenhauser, who's the Chief Quality and Patient Safety Officer at Ohio State University's Wexner Medical Center, where he conducted a national survey assessing the risks of large holiday gatherings amidst COVID-19. Welcome to Background Briefing, Dr. Ian Gonsenhauser.
Thank you so much for having me on.
Well, thanks for joining us, and we're revisiting you because obviously there was an uptick after the holiday gatherings of COVID, not surprising, but there's likely to be an uptick now that we have this dangerous combination of pandemic fatigue, states opening up prematurely, and a widely circulating variants of COVID-19, particularly the virulent Brazilian strain. So, given that the governors of Texas and Mississippi were the first to open up the state, largely in the case of Governor Abbott, because he wanted to distract the Texas public, who were furious at his mishandling of the ice storm that caused electrical blackouts and froze the pipes in homes in Texas. That was quickly followed by Mississippi 30 minutes later. It looks as if a lot of Republican governors are going to start grandstanding and doing the same thing. So what do you think Biden's going to say tonight as we go to air? He begins his first national address. What do you think he's going to say to stop this irresponsible behavior on the part of Republican governors?
Yeah, it's hard to know how he is going to address both the leadership in politics at both the national and the state level, as well as how he's going to address the American public. My assumption is that he's going to make an appeal for everybody to really try and use their better judgment and to understand that we all want this to be over. Everybody wants the pandemic to conclude, but no matter how much we may want it, that doesn't mean it is, and it doesn't make it so. And we really have to continue to stick to the risk mitigation measures that we know have driven numbers down throughout the course of the past year, because we are in a race right now to get vaccination and public immunity to the levels that we need it to be at in order to really conclude this pandemic. And the choices that we're making right now to not act as responsibly as we know we can are only going to accomplish one thing, and that is an extension of the current situation and a longer length of time before we can truly conclude this pandemic.
Well, clearly the virus doesn't recognize state boundaries, nor does it recognize international boundaries. So when you have a group of parents and young children burning masks in front of the State House in Idaho, you just scratch your head and wonder, is there any way to neutralize that kind of willful ignorance?
Yeah, I think that comes down to the people who have the ear of those individuals. Your constituents, if they are listening to you, you have a responsibility to act in their best interest. For us in healthcare, we understand that there are different levels of health literacy in the general public. And our responsibility is to help people make truly informed decisions, that they can still be their own decisions, that we respect the autonomy of individuals and of patients. But our responsibility is to assure that they have good information, reliable information that they understand, comprehend fully, so that they can truly make informed decisions. What we're seeing right now are political leaders in various parts of the country that are taking advantage of limited health literacy rather than trying to overcome that as a barrier to informed decision-making. And we're seeing that advantage abused in order to propel people's personal political ambitions.
Well, a prime example, of course, is the former president, who among his many irresponsible acts, which have led to the deaths of about 530,000 Americans going back to a year ago, which I guess is what Biden's speech is on the anniversary of Trump's first speech, where he said it was all going to go away soon. But what I find particularly galling is that both former President Trump and his wife Melania had their vaccines done in secret and didn't want to publicize it, as opposed to others like Biden, who showed himself getting vaccinated on camera.
Yeah, I mean, personally, I look at every opportunity to help educate the public as an opportunity that I can't pass up as a responsible citizen of this nation, let alone a role in healthcare or leadership in a hospital or anything like that. These are all opportunities to just be good citizens and help the people of this nation, regardless of political leanings, regardless of and any of those things. I mean, we have a responsibility. If you have the knowledge and you have the reach and you have the attention of individuals across the nation, you should be using that for their benefit. And we just have lost and seen the squandering of so many incredible opportunities to do that. And the result has been, a worsening of probably the worst public health crisis that any of us have ever lived through in terms of an infectious pathogen. And we've seen now, deaths across this nation now outpace handily, even the Second World War. And to think that we've lost more American lives to COVID in the past year than the entirety of World War II, that's sobering, staggering, and really disappointing, because we all know we could have done better.
And again, I'm speaking with Dr. Ian Gonsenhauser, who's the Chief Quality and Patient Safety Officer at Ohio State University's Wexner Medical Center, where he conducted a national survey assessing the risk of large holiday gatherings amidst COVID-19. And Dr. Michael Osterholm, the epidemiologist who's on advising the Biden administration, he's giving some pretty dire predictions about how the worst is yet to come. Now, we are losing 1,500 Americans per day, which is bad enough. But what's the prognosis on the Brazilian strain? Again, as I mentioned earlier, the virus recognizes no national or international borders. So it's just a matter of time before that strain hits the United States in a wave. And the race has always been between vaccination and mutation. And the longer you delay and dilly-dally, as Trump did, the more time the virus has to mutate. And apparently this Brazilian strain is so much more virulent and so much more infectious. But it also, there's some evidence apparently that you can be reinfected by it.
Yeah, absolutely. I mean, Dr. Osterholm is a brilliant, highly experienced, educated mind that like Anthony Fauci and a handful of others across the nation, we should be giving absolute credence to the guidance that he is providing. He's giving us really phenomenal information that we can utilize to see better outcomes potentially if we're listening and if we're willing to take his advisement. The P1 virus, the Brazilian virus, you're absolutely right. We're seeing not only that it has some advantages as far as transmissibility and its contagiousness, but also has this unique ability maybe that we're starting to see show up in some preliminary research. And we're waiting for really the fully validated research to substantiate this. But we're starting to see indications that, in fact, it may reinfect those who have already been infected, those who should have immunity within the window that they should still continue to have that protection. And that's really scary. It's scary because it means anybody could potentially still be at risk, regardless of whether or not you've had the virus before or if you've been vaccinated, potentially. And that really throws this all in a loop. It puts this completely upside down. And it really causes us to potentially question, where we're at and what protection we've achieved, both through vaccination and natural inoculation for those whom have already been exposed to COVID. If that happens, we can potentially see ourselves right back where we were months ago. And that's the last thing any of us want, surely.
So if we are at war with the COVID virus, and I'm not sure that Biden will use that analogy, but it has been used before. I think Dr. Fauci, for example, has used it. Is there a way, or is it fair, do you think, to characterize people that deliberately put out bad information, who advise people to do the opposite of what they should be doing. Could you categorize people like Governor Abbott and, of course, Trump himself as war criminals because of their irresponsible behavior has caused the deaths of, in this case, hundreds of thousands of people?
Yeah, I think the term is fairly specific in its definition, and I don't know that we would go so far as to utilize that specific term just because of its really particular connotations and particular definition. But I think you can absolutely suggest that those individuals are not fulfilling their patriotic duty. These are not patriots of our United States or really our even global community. These are individuals who are deliberately misleading the public and costing human life. These are, maybe you would say enemies of the state might be a more apt term than necessarily war criminal. But I think that the sentiment carries, and I think that the idea is there. Individuals who are deliberately acting against the greater good, against the public good, should really be held accountable for those actions. There are lives being lost because of their words, because of their actions, because of their influence, and that's unconscionable and should be intolerable. We should have zero tolerance for that misleading of the American public.
And of course, they're doing it for selfish political reasons, thinking that this will help them. And that's the part that I find kind of heartbreaking is seems to be support out there for not wearing masks, for prematurely opening up the country. So do you think that tonight Biden can help move the needle in the other direction?
Yeah, I believe that I'm an optimist, and I've become more of an idealist as I've grown. I think there is a large cohort of the U.S. public that may have succumbed to misinformation over the past 4 years, but has come to realize why it was motivated, why it was perpetrated, and how they were really taken advantage of by some of the individuals that you've named. And I think that large cohort of people are no longer willing to be duped in that way for political purposes. And I do believe there is a rejection amongst a large group of much of the misinformation that they were exposed to over the past year or few years. So I think there's a large group of people that will respond, that will answer their nation's call and will do the right things to stay responsible and help us move through this as quickly as possible with the least loss of life that we can achieve at this point.
So just in closing, Dr. Ian Gonsenhauser, given that the vaccines are accelerating and Johnson & Johnson has added to Moderna and Pfizer, and things seem to be moving quite expeditiously in that direction, how much do you think the vaccine resistance will play a part? Obviously, you need to get, over 70% of the public inoculated to get herd immunity.
Yeah, I think vaccine hesitancy is going to become more and more apparent as we've moved through making the vaccine available to all those who want it. So we're still at the point now where the majority of the country below the age of 50 and above the age of 18 have not had their opportunity to become vaccinated in most states. So I think we need to move through those lower age cohorts and some of our underserved areas, low access areas as well. We need to provide that access so those individuals can become vaccinated, really get a better understanding of what percentage of the country is vaccinated once we've done that. But I do believe there is going to be a significant proportion of the population that will refuse vaccination, that we will be unable to reach. And as a result of that, there's a good chance that COVID remains with us and is something that just becomes a part of our daily life, much like the flu, much like other common colds. And to think that we will be dealing with COVID for the foreseeable and potentially permanent future is really, really unsettling and unsatisfying. And I hope that people realize that by choosing not to engage in vaccination, not to engage in precautionary measures, you are choosing to perpetuate the COVID pandemic.
Well, Dr. Ian Gunzenhauser, I thank you very much for joining us here today.
Thank you so much for having me on. Always a pleasure.
Well, thank you. And again, I've been speaking with Dr. Ian Gunzenhauser, who's the Chief Quality and Patient Safety Officer at Ohio State University's Wexner Medical Center, where he conducted a national survey assessing the risks of large holiday gatherings amidst COVID-19. We're going to take a brief station break and back speaking with the spokesperson for Fix Our Senate, a group dedicated to ending the